Question 1. When evaluating a patient's complaint of pain in the upper outer quadrant of the right breast, which anatomical term most accurately describes the location for documentation purposes? Option A, right breast's upper outside region. Option B, upper outer part of the right breast. Option C, superior lateral quadrant of the right breast. Option D, top right breast area. The correct answer is C, superior lateral quadrant of the right breast. Explanation. This scenario presents a professional challenge because accurate anatomical terminology is crucial for clear, concise, and safe patient communication and documentation. Misinterpreting or misusing anatomical terms can lead to diagnostic errors, incorrect treatment plans, and potential patient harm. The risk assessment here involves understanding the potential consequences of imprecise language in a healthcare setting. The correct approach represents best professional practice because it prioritizes accuracy and clarity in medical communication, directly aligning with the NHA CCMA exam's emphasis on foundational medical knowledge. Using precise anatomical terms ensures that all healthcare professionals involved in a patient's care have a shared understanding of the patient's condition and location of findings. This adherence to established terminology is implicitly supported by general healthcare regulations and professional standards that mandate accurate record-keeping and communication to ensure patient safety and quality of care. An incorrect approach that relies on vague or colloquial descriptions fails to meet professional standards. Such an approach introduces ambiguity, increasing the risk of misinterpretation by other healthcare providers. This can lead to delays in diagnosis or treatment, or even incorrect interventions, violating ethical obligations to provide competent care and potentially breaching regulatory requirements for accurate medical documentation. Another incorrect approach that uses terms from a different anatomical system, e.g., referring to a bone when describing a muscle, demonstrates a fundamental lack of understanding of anatomical relationships. This is not only unprofessional but also dangerous, as it can lead to severe miscommunication about the patient's physical condition, directly impacting diagnostic and treatment pathways. This failure to grasp basic anatomical principles is a significant professional and ethical lapse. The professional decision-making process for similar situations should involve a systematic approach. First, accurately identify the anatomical structure or region being described. Second, recall or consult reliable anatomical resources to confirm the correct terminology. Third, use the precise term in all documentation and communication. If unsure, it is always better to verify the term before using it, rather than risking an error. This methodical verification process mitigates the risk of miscommunication and ensures adherence to professional standards of practice. Question 2. Market research demonstrates a growing demand for outpatient infusion services. A physician asks a certified medical assistant, CCMA, to initiate an intravenous Roman 4 line and administer a prescribed antibiotic infusion to a patient in the clinic setting. The CCMA has not received specific training or certification in Roman 4 therapy administration. Option A. The CCMA should politely decline the request, explaining that Roman 4 administration is outside their scope of practice as defined by the NHA CCMA certification and relevant state regulations, and offer to assist with other tasks within their capabilities. Option B. The CCMA should attempt to find an online tutorial to quickly learn how to administer Roman 4 infusions before proceeding with the physician's request. Option C. The CCMA should proceed with initiating the Roman 4 and administering the infusion, assuming the physician's order supersedes their scope of practice limitations. Option D. The CCMA should inform the physician that they are uncomfortable but proceed if the physician insists, as the physician is ultimately responsible for patient care. The correct answer is A. The CCMA should politely decline the request, explaining that Roman 4 administration is outside their scope of practice, as defined by the NHA CCMA certification and relevant state regulations, and offer to assist with other tasks within their capabilities. Explanation. This scenario presents a professional challenge because a medical assistant, MA, is being asked to perform a task that falls outside their defined scope of practice, according to NHA CCMA guidelines and relevant U.S. federal and state regulations governing medical assistants. The MA must navigate the request from a supervising physician while adhering strictly to their certification and legal limitations. The correct approach involves the MA clearly and professionally communicating their limitations to the physician, explaining that administering an intravenous Roman 4 infusion is beyond the CCMA scope of practice. This aligns with the NHA CCMA certification standards, which emphasize that MAs are trained to perform specific clinical and administrative tasks, but do not include administering Roman 4 medications or fluids. Best professional practice dictates that MAs must operate within their legally defined scope of practice to ensure patient safety and avoid legal repercussions. This also upholds ethical principles of competence and avoiding harm. An incorrect approach would be for the MA to attempt the Roman 4 infusion. This represents a significant regulatory and ethical failure. It violates the NHA CCMA scope of practice, potentially contravening state medical practice acts that define what licensed and certified healthcare professionals can do. Forming an act outside one's scope of practice can lead to patient harm, disciplinary action by licensing boards, loss of certification, and legal liability for both the MA and the supervising physician. Another incorrect approach would be to ignore the request without communication. This is a failure of professional responsibility and communication, potentially leaving the physician unaware of the MA's limitations and delaying appropriate patient care. The professional decision-making process for similar situations requires the MA to first understand their scope of practice as defined by their certification body, NHA CCMA, and state regulations. Upon receiving a request that seems outside this scope, the MA should pause, recall their training and the established guidelines. The next step is to communicate clearly and respectfully with the requesting provider, explaining the limitation without being confrontational. The MA should offer to assist in ways that are within their scope, such as preparing the patient, gathering supplies, or documenting the procedure if performed by a qualified individual. This ensures patient care is not compromised while maintaining professional integrity and adherence to regulations. Question 3. The efficiency study reveals that a patient experiencing frequent bloating and abdominal discomfort after meals has a reduced ability to absorb certain fats and fat-soluble vitamins. Based on the principles of nutrient absorption, which of the following explanations would be most appropriate for the medical assistant to provide to the patient? Option A. Your body is having trouble breaking down and absorbing fats in the small intestine, which is where most fat digestion and absorption occurs. This can lead to the symptoms you're experiencing. Option B. You should avoid all dairy products as they are known to cause digestive upset. Option C. You need to eat more fiber to help your digestive system move things along. Option D. Your symptoms are likely due to stress and you should try to relax more. The correct answer is A. Your body is having trouble breaking down and absorbing fats in the small intestine, which is where most fat digestion and absorption occurs. This can lead to the symptoms you're experiencing. Explanation. Scenario analysis. This scenario presents a common challenge in patient education, where a medical assistant must translate complex physiological processes into understandable terms for a patient experiencing digestive discomfort. The challenge lies in accurately conveying information about nutrient absorption without oversimplifying to the point of inaccuracy or overwhelming the patient with technical jargon. The medical assistant must also consider the patient's potential anxiety and their need for practical, actionable advice. Correct approach analysis. The correct approach focuses on identifying the most likely cause of malabsorption based on the patient's symptoms and dietary habits, and then providing education that directly addresses this, explaining how specific nutrients are absorbed in different parts of the digestive tract and how certain foods might interfere with this process is crucial. This aligns with the NHA CCMA exam's emphasis on patient education and understanding of basic physiological functions relevant to common patient complaints. It represents best professional practice by empowering the patient with knowledge to make informed dietary choices and manage their symptoms, thereby promoting adherence to treatment plans and improving health outcomes. This approach is ethically sound as it prioritizes patient understanding and well-being. Incorrect approaches analysis. One incorrect approach might involve providing a generic list of healthy foods without explaining why these foods are beneficial or how they relate to the patient's specific symptoms. This fails to address the root cause of the malabsorption and doesn't equip the patient with the knowledge to make targeted dietary changes. Could lead to continued discomfort and frustration, potentially violating the ethical principle of providing effective care. Another incorrect approach could be to simply recommend avoiding all difficult-to-digest foods without further clarification. This is overly broad and could lead to unnecessary dietary restrictions, potentially causing nutrient deficiencies. It lacks the specificity required for effective patient management and fails to educate the patient on the mechanisms of absorption, thus not fostering self-management. A third incorrect approach might be to dismiss the patient's concerns and attribute their symptoms solely to stress, without exploring potential physiological causes related to nutrient absorption. This is professionally negligent and ethically problematic, as it fails to adequately assess the patient's condition and could delay appropriate diagnosis and treatment. Professional reasoning. When faced with a patient experiencing symptoms potentially related to nutrient absorption, a medical assistant should follow a systematic approach. 1. Listen attentively to the patient's symptoms and history. 2. Correlate symptoms with basic physiological knowledge of digestion and absorption. 3. Educate the patient in clear, understandable language about relevant processes. 4. Provide specific, actionable advice tailored to their situation. 5. Document the education provided and any patient responses. This structured approach ensures patient safety, promotes understanding, and upholds professional standards of care. Question 4. The performance metrics show a consistent pattern of patients reporting increased discomfort and limited mobility following specific physical therapy exercises for lower back pain. As a medical assistant, what is the most appropriate action to take when a patient reports their pain has worsened despite following the prescribed exercise regimen? Option A. Document the patient's subjective report of increased pain and any observed objective findings, such as swelling or restricted movement, and communicate this information to the supervising physician or physical therapist for further evaluation and potential adjustment of the treatment plan. Option B. Advise the patient to rest for a few days and avoid the exercises until their pain subsides, without consulting the supervising physician. Option C. Record in the patient's chart that the patient is likely exaggerating their pain symptoms, as there are no significant objective findings. Option D. Suggest the patient try a different set of exercises that they believe might be more effective, bypassing the prescribed treatment plan. The correct answer is A. Document the patient's subjective report of increased pain and any observed objective findings, such as swelling or restricted movement, and communicate this information to the supervising physician or physical therapist for further evaluation and potential adjustment of the treatment plan. Explanation. The performance metrics show a concerning trend in patient-reported outcomes related to musculoskeletal pain management following physical therapy. This scenario is professionally challenging because it requires the medical assistant to interpret subjective patient feedback and connect it to objective clinical observations and established protocols, all while adhering to the NHA CCMA exam scope of practice and regulatory guidelines. Accurate assessment and appropriate action are crucial for patient safety and effective care. The correct approach represents best professional practice because it aligns with the NHA CCMA role in patient care and documentation. By accurately documenting the patient's subjective report of increased pain and correlating it with objective findings such as swelling or limited range of motion, the medical assistant is providing essential information for the supervising physician or physical therapist. This detailed documentation facilitates informed clinical decision-making, ensuring the patient receives timely and appropriate adjustments to their treatment plan. This adheres to the principle of accurate record-keeping and effective communication within the healthcare team, which are fundamental to patient safety and regulatory compliance. An incorrect approach that involves dismissing the patient's subjective report of increased pain due to a lack of visible objective signs fails to acknowledge the validity of patient-reported symptoms. This can lead to undertreatment of pain and a delay in necessary interventions, potentially worsening the patient's condition. Ethically, it violates the principle of patient-centered care and can be seen as a failure to adequately assess the patient's needs. From a regulatory standpoint, it represents a lapse in thorough patient assessment and documentation. Another incorrect approach, such as immediately recommending over-the-counter pain medication without physician approval, exceeds the scope of practice for a medical assistant. The intention might be to alleviate discomfort. This action bypasses the physician's authority and the established treatment plan, posing a risk to the patient if the medication is contraindicated or if the pain indicates a more serious underlying issue requiring a different medical intervention. This constitutes a violation of professional boundaries and regulatory guidelines regarding medication administration and physician oversight. A further incorrect approach, such as documenting the patient's complaint as "patient is exaggerating pain" without objective evidence or physician consultation, is unprofessional and unethical. This subjective and unsubstantiated notation can negatively impact the patient's care trajectory and create a biased record. It demonstrates a lack of objective observation and professional judgment, potentially leading to misdiagnosis or inappropriate treatment by other healthcare providers. This is a direct failure in maintaining an accurate and objective medical record. The professional reasoning process for similar situations should involve a systematic approach. First, actively listen to and document the patient's subjective complaints accurately and without judgment. Second, perform objective assessments within the scope of practice, noting any relevant physical findings. Third, communicate these findings clearly and concisely to the supervising healthcare provider. Finally, follow the provider's instructions for any necessary interventions or further assessments, ensuring all actions are documented. This structured approach ensures patient safety, regulatory compliance, and effective team collaboration. Question 5. The control framework reveals that a medical assistant encounters the term nephrolithiasis in a patient's chart. Which of the following demonstrates the most accurate understanding of this term based on its word parts? Option A, a disease affecting the nerves. Option B, a surgical procedure on the bladder. Option C, a condition related to the kidney and the presence of stones. Option D, an inflammation of the stomach. The correct answer is C, a condition related to the kidney and the presence of stones. Explanation. The control framework reveals that a medical assistant must possess a strong understanding of medical terminology, including prefixes, suffixes, and root words, to accurately interpret and document patient information. This is crucial for patient safety and effective communication within the healthcare team. Misinterpreting or misapplying these word parts can lead to incorrect charting, medication errors, or inappropriate treatment plans, all of which pose significant risks to patient well-being and could result in regulatory violations related to accurate record-keeping and patient care standards. The correct approach involves a systematic breakdown of the medical term to identify its constituent parts and understand its meaning. This demonstrates a commitment to accuracy and adherence to professional standards for documentation, as mandated by NHA CCMA guidelines, which emphasize precise medical record-keeping. By correctly deciphering the term, the medical assistant ensures that the patient's chart accurately reflects their condition and the services provided, minimizing the risk of miscommunication and subsequent harm. An incorrect approach of guessing the meaning based on a partial understanding or ignoring the term altogether represents a failure to uphold professional responsibilities. Guessing can lead to the documentation of inaccurate information, which is a direct violation of the NHA's emphasis on accurate medical records. Ignoring the term means that critical patient information may be omitted from the record, hindering continuity of care and potentially leading to adverse events. Relying solely on context without understanding the root word, prefix, or suffix can also lead to misinterpretations, as context alone can be misleading. Professional decision-making in such situations requires a methodical approach. First, attempt to break down the word into its known components, prefix, root, suffix. If the meaning is still unclear, consult reliable medical terminology resources, such as a medical dictionary or approved NHA study materials. If ambiguity persists, it is best practice to seek clarification from a supervisor or the ordering healthcare provider before documenting. This ensures accuracy and patient safety, aligning with the core principles of medical assisting practice. Question 6. Strategic planning requires a medical assistant to effectively manage patient information. When documenting a patient's vital signs, which of the following approaches best ensures accurate and safe communication of medical data, adhering to common medical abbreviations? Option A. Employing personal shorthand and abbreviations that are easily understood by the individual medical assistant. Option B. Using abbreviations found in general dictionaries that may not be specific to medical contexts. Option C. Utilizing a standardized, organization-approved list of medical abbreviations and ensuring all staff are trained on its correct application. Option D. Relying on memory for common abbreviations without consulting a reference guide. The Correct answer is C. Utilizing a standardized, organization-approved list of medical abbreviations and ensuring all staff are trained on its correct application. Explanation: this scenario is professionally challenging because the accurate and efficient communication of patient information is paramount to patient safety and continuity of care. Misinterpreting or misusing medical abbreviations can lead to significant errors in diagnosis, treatment, and medication administration, directly impacting patient outcomes. Careful judgment is required to ensure all healthcare team members understand and use abbreviations consistently and correctly, adhering to established protocols. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By utilizing a standardized list of approved abbreviations and ensuring all staff are trained on its proper use, the medical assistant upholds the principles of clear communication and reduces the risk of errors. This aligns with NHA CCMA exam expectations, which emphasize the importance of accurate documentation and communication within the healthcare setting. Adherence to organizational policy regarding abbreviations is a direct reflection of professional responsibility and a commitment to quality patient care. An incorrect approach that involves using personal shorthand or unapproved abbreviations is a significant regulatory and ethical failure. This practice introduces ambiguity and increases the likelihood of misinterpretation by other healthcare providers, potentially leading to adverse events. It violates the ethical principle of beneficence, acting in the patient's best interest, by compromising the safety of care. Furthermore, it fails to comply with potential organizational policies and best practices for medical documentation, which are often implicitly or explicitly guided by regulatory standards aimed at ensuring accurate record-keeping. Another incorrect approach, such as relying solely on memory without verification, is also professionally unacceptable. Medical abbreviations can be numerous and context-dependent. Memory can be fallible, and without a reference, the risk of using an incorrect or ambiguous abbreviation is high. This demonstrates a lack of diligence and a failure to employ best practices for information accuracy, which could have serious consequences for patient care and may not meet the standards expected by regulatory bodies overseeing healthcare practice. The professional decision-making process for similar situations should involve a commitment to continuous learning and adherence to established protocols. When encountering an unfamiliar abbreviation, or when in doubt about its meaning or appropriateness, a medical assistant should always consult a reliable, up-to-date resource, such as an organizational policy manual or a recognized medical dictionary. Prioritizing clarity and accuracy over speed or personal convenience is essential. This involves actively participating in training, seeking clarification when needed, and consistently applying organizational standards for documentation and communication. Question 7. System analysis indicates a medical assistant is taking a patient's vital signs and notes a blood pressure reading of 160/100 mmHg on an adult patient. The patient has no reported history of hypertension. The MA has reviewed the standard normal ranges for adult blood pressure. Which of the following actions best demonstrates adherence to NHA CCMA exam guidelines for handling abnormal findings? Option A. Record the reading as normal for this patient and proceed with the rest of the examination. Option B. Advise the patient to reduce their salt intake and schedule a follow-up appointment in 1 month. Option C. Document the reading and inform the supervising physician immediately for further assessment and orders. Option D. Retake the blood pressure in 15 minutes and if still elevated, then document it. The correct answer is C. Document the reading and inform the supervising physician immediately for further assessment and orders. Explanation: scenario analysis. This scenario presents a common implementation challenge for a medical assistant MA working within the NHA CCMA framework. The challenge lies in accurately interpreting and responding to vital sign readings that fall outside established normal ranges, while adhering to established protocols and ensuring patient safety. The MA must exercise critical judgment to differentiate between a potentially urgent situation requiring immediate physician notification and a finding that may warrant further observation or routine follow-up, all within the scope of their practice as defined by NHA CCMA guidelines. Correct approach analysis. The correct approach involves recognizing the abnormal finding, cross-referencing it with established normal ranges for the patient's demographic, and then following the clinic's established protocol for reporting abnormal vital signs to the supervising physician or licensed healthcare provider. This aligns with NHA CCMA standards, which emphasize the MA's role in data collection and reporting, ensuring that deviations from normal are communicated promptly to facilitate appropriate medical intervention. This practice upholds patient safety by ensuring timely clinical assessment and management. Incorrect approaches analysis. One incorrect approach is to ignore the abnormal reading, assuming it is a temporary fluctuation or an error. This is a significant ethical and regulatory failure. The NHA CCMA exam emphasizes the MA's responsibility to accurately record and report all findings, especially those outside normal parameters. Ignoring such a finding could delay critical diagnosis and treatment, directly violating patient safety principles and potentially leading to adverse outcomes, which is contrary to the standards of practice expected of a certified MA. Another incorrect approach is to immediately administer a treatment or make a diagnosis based on the abnormal reading without consulting the physician. This exceeds the MA's scope of practice as defined by NHA CCMA guidelines. MAs are trained to collect data and report, not to diagnose or prescribe treatment. Such an action would be a direct violation of professional boundaries and regulatory limitations, potentially causing harm to the patient and exposing the MA and the practice to legal repercussions. A third incorrect approach is to document the abnormal finding, but fail to communicate it to the supervising physician or licensed healthcare provider. While documentation is crucial, the primary purpose of identifying an abnormal finding is to trigger appropriate clinical action. Failing to communicate the finding negates the value of its identification and represents a breakdown in the patient care process, which is a failure to meet the expected standard of care under NHA CCMA guidelines. Professional reasoning. When faced with an abnormal vital sign, a medical assistant should follow a systematic decision-making process. 1. Verify the reading for accuracy. 2. Compare the reading to established normal ranges for the patient's age and condition. 3. Consult the clinic's established protocols for reporting abnormal findings. 4. Promptly and accurately communicate the finding, along with relevant patient information, to the supervising physician or licensed healthcare provider. 5. Document the communication and any subsequent orders received. This process ensures patient safety, adheres to regulatory requirements, and maintains professional integrity within the scope of practice. Question 8. Governance review demonstrates that a patient presents with a chief complaint of sore throat and difficulty swallowing. Based on the NHA CCMA exam's focus on the anatomy of the respiratory tract, which anatomical region is most likely the primary site of inflammation causing these symptoms. Option A, the alveoli. Option B, the trachea. Option C, the pharynx. Option D, the diaphragm. Correct answer is C, the pharynx. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to apply their knowledge of respiratory anatomy in a patient care context, specifically when a patient presents with symptoms that could indicate a problem within a particular section of the respiratory tract. Accurate identification of the affected area is crucial for effective communication with the physician and for ensuring appropriate patient management. Misidentification can lead to delays in diagnosis and treatment, potentially impacting patient outcomes. Correct approach analysis. The correct approach involves accurately identifying the anatomical structure most likely involved based on the patient's symptoms. Understanding that inflammation and swelling in the pharynx throat are characteristic of pharyngitis, and that this structure is part of the upper respiratory tract, allows the medical assistant to provide precise information to the physician. This aligns with professional practice by ensuring clear, accurate, and relevant communication, which is a cornerstone of patient safety and effective healthcare delivery under NHA CCMA guidelines. Incorrect approaches analysis. An approach that focuses solely on the lungs without considering the possibility of upper airway involvement is a regulatory and ethical failure. The NHA CCMA exam emphasizes a comprehensive understanding of anatomy and physiology. Ignoring the upper respiratory tract when symptoms suggest it could be the primary site of the issue demonstrates a lack of thoroughness and can lead to miscommunication and incorrect assumptions by the physician. This failure to consider all relevant anatomical structures violates the principle of providing complete and accurate patient information. Another incorrect approach would be to focus on a structure outside the respiratory tract entirely, such as the digestive system. This represents a significant failure in anatomical knowledge and diagnostic reasoning, directly contravening the NHA CCMA requirement for a foundational understanding of the body's systems. Such an approach would be ethically unacceptable due to the potential for misdiagnosis and harm to the patient. Finally, an approach that is vague or uses nonspecific terminology when a precise anatomical location can be identified is also professionally unacceptable. The NHA CCMA exam expects medical assistants to use accurate medical terminology. Vague descriptions hinder effective communication and can lead to misunderstandings, which is a failure in professional responsibility. Professional reasoning. Medical assistants should approach patient presentations by systematically considering the symptoms and correlating them with anatomical structures. When a patient presents with throat pain and difficulty swallowing, the initial thought process should involve the upper respiratory tract, specifically the pharynx. This systematic approach, grounded in anatomical knowledge, allows for accurate reporting to the physician, facilitating prompt and appropriate care. Professionals should always strive for precision and clarity in their observations and communications. Question 9. The risk matrix shows a moderate to high likelihood of a cardiovascular event given the patient's reported symptoms of chest tightness and shortness of breath, coupled with a history of hypertension. As a certified clinical medical assistant, CCMA, what is the most appropriate immediate action to take? Option A. Immediately inform the supervising physician or licensed healthcare provider about the patient's symptoms and history. Option B. Ask the patient to describe their chest tightness in more detail and if they have any other discomfort. Option C. Reassure the patient that these symptoms are common with anxiety and are likely not serious. Option D. Advise the patient to take an aspirin and rest for a few minutes to see if symptoms improve. The correct answer is A. Immediately inform the supervising physician or licensed healthcare provider about the patient's symptoms and history. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical assistant to interpret subtle signs of a potentially serious cardiovascular event in a patient who may not be able to clearly articulate their symptoms. The risk matrix highlights the potential for rapid deterioration, demanding prompt and accurate assessment. The medical assistant must balance the need for immediate action with the established protocols for patient care and communication. Correct approach analysis. The correct approach involves recognizing the potential urgency of the patient's symptoms, which are suggestive of a cardiovascular issue, and immediately notifying the licensed healthcare provider. This aligns with NHA CCMA exam guidelines, emphasizing the medical assistant's role in patient observation, reporting, and assisting the provider. Promptly informing the provider allows for timely medical intervention, which is critical in managing cardiovascular emergencies and preventing adverse outcomes. This demonstrates adherence to the principle of patient safety and the scope of practice for a CCMA. Incorrect approaches analysis. Failing to immediately notify the provider and instead attempting to gather more subjective information or waiting for the patient to worsen represents a failure to recognize the potential severity of the situation. This delays necessary medical assessment and intervention, potentially violating patient safety standards and the CCMA duty to report significant changes in a patient's condition. It also demonstrates a lack of understanding of the urgency associated with potential cardiovascular distress. Suggesting the patient take over-the-counter medication without a provider's order is a direct violation of scope of practice. Medical assistants are not authorized to prescribe or recommend medications. This action could lead to adverse drug interactions or mask symptoms, further complicating diagnosis and treatment, and is a clear regulatory and ethical breach. Dismissing the patient's symptoms as minor or unrelated to a serious condition without a thorough assessment by a licensed provider is negligent. It undervalues the patient's experience and can lead to misdiagnoses of critical illnesses, directly compromising patient care and safety. This approach fails to uphold the professional responsibility to advocate for the patient's well-being. Professional reasoning. Professionals should use a decision-making framework that prioritizes patient safety and adheres to their scope of practice. This involves 1. Recognizing and assessing the patient's reported symptoms and vital signs for any signs of distress or potential emergency. 2. Understanding the urgency of the situation based on the potential for rapid deterioration, especially with cardiovascular symptoms. 3. Immediately communicating any concerning findings or patient complaints to the supervising licensed healthcare provider. 4. Following the provider's instructions for further assessment or intervention. 5. Documenting all observations and communications accurately. Question 10. Process analysis reveals that during a patient encounter, a medical assistant hears a medical term that is unfamiliar and cannot be immediately recognized. The physician dictates this term into the patient's electronic health record. The medical assistant is unsure of the exact spelling and meaning of this term. Which of the following actions best demonstrates adherence to NHA CCMA exam standards for patient care and documentation? Option A. Ignore the unfamiliar term and proceed with documenting other aspects of the patient's visit. Option B. Document the term as it was heard, assuming it is a common medical condition. Option C. Guess the meaning of the term and document what is believed to be the correct medical equivalent. Option D. Ask the physician or supervising nurse for clarification of the term and its correct spelling before documenting it. The correct answer is D. Ask the physician or supervising nurse for clarification of the term and its correct spelling before documenting it. Explanation. Scenario analysis. This scenario presents a common challenge in a medical setting where a medical assistant (MA) encounters unfamiliar medical terminology. The professional challenge lies in accurately understanding and documenting patient information to ensure continuity of care and patient safety. Misinterpreting or misdocumenting medical terms can lead to diagnostic errors, inappropriate treatment, and potential harm to the patient. The MA must demonstrate a commitment to professional development and accurate record keeping, adhering to NHA CCMA exam standards. Correct approach analysis. The correct approach involves actively seeking clarification from a qualified healthcare professional, such as the physician or nurse, and then accurately documenting the clarified term. This aligns with the NHA CCMA exam's emphasis on accurate patient care and communication. Regulatory guidelines for medical assistants, as tested by the NHA, mandate precise documentation and adherence to the scope of practice. Seeking clarification ensures the MA is acting within their knowledge base and is not making assumptions that could compromise patient care. Accurate documentation is a legal and ethical requirement, protecting both the patient and the healthcare provider. Incorrect approaches analysis. Failing to seek clarification and guessing the meaning of the term is a significant ethical and regulatory failure. It demonstrates a lack of diligence and a disregard for patient safety, violating NHA CCMA standards for accurate record keeping. This could lead to incorrect charting, miscommunication among the healthcare team, and potentially adverse patient outcomes. Documenting the term as heard without understanding its meaning is also a failure. While it might seem like an attempt at accuracy, it perpetuates potential misinformation. The NHA CCMA exam stresses the importance of understanding and correctly applying medical terminology, not just transcribing it. This approach risks misinterpretation by other healthcare professionals. Assuming the term is a common misspelling of a more familiar word without verification is another problematic approach. Medical terminology can be nuanced, and assumptions can lead to critical errors. The NHA CCMA exam expects MAs to be precise and to verify information rather than relying on assumptions, especially when patient care is involved. Professional reasoning. When faced with unfamiliar medical terminology, a medical assistant should follow a structured decision-making process. 1. Recognize the unfamiliar term. 2. Immediately pause any documentation or action that relies on the term's meaning. 3. Seek clarification from the appropriate healthcare provider, physician, nurse, etc. 4. Confirm the correct spelling and meaning of the term. 5. Accurately document the term as clarified. This process prioritizes patient safety, adheres to professional standards, and ensures compliance with regulatory requirements tested by the NHA CCMA exam. Question 11. Operational review demonstrates a patient presenting with complaints of fatigue, unexplained weight changes, and sensitivity to temperature. The medical assistant is aware that these symptoms can be associated with the function of major endocrine glands. What is the most appropriate action for the medical assistant to take in this situation? Option A. Inform the patient that their symptoms strongly suggest a problem with their thyroid gland and advise them to seek immediate specialist care. Option B. Reassure the patient that these symptoms are common and likely due to stress and suggest they try to relax more. Option C. Document the patient's reported symptoms and vital signs accurately and then communicate this information to the licensed healthcare provider for further assessment and diagnosis. Option D. Provide the patient with a brochure on common endocrine disorders and encourage them to research their symptoms online. The correct answer is C. Document the patient's reported symptoms and vital signs accurately, and then communicate this information to the licensed healthcare provider for further assessment and diagnosis. Explanation. Scenario analysis. This scenario presents a challenge because a medical assistant must interpret a patient's symptoms and relate them to potential endocrine system dysfunction without overstepping their scope of practice. The medical assistant needs to recognize the significance of the reported symptoms while understanding their role in data collection and patient support, not diagnosis. Correct approach analysis. The correct approach involves accurately documenting the patient's reported symptoms and vital signs, and then communicating this information clearly to the licensed healthcare provider. This aligns with NHA CCMA exam guidelines, which emphasize accurate data collection and reporting as a core competency. It upholds professional practice by ensuring the patient's concerns are heard and addressed by the appropriate medical professional, respecting the provider's diagnostic authority and the assistant's supportive role. Incorrect approaches analysis. One incorrect approach would be to suggest a specific diagnosis related to a major gland, such as stating the patient likely has a thyroid issue. This is a direct violation of the CCMA scope of practice, which prohibits diagnosis. Ethically and regulatorily, this constitutes practicing medicine without a license. Another incorrect approach would be to dismiss the patient's symptoms as insignificant or unrelated to any serious condition. This fails to uphold the ethical duty of care and could lead to delayed diagnosis and treatment, potentially harming the patient. It also demonstrates a lack of understanding of how seemingly minor symptoms can be indicative of underlying endocrine imbalances. A third incorrect approach would be to provide the patient with detailed information about specific endocrine disorders and their treatments without the direction of the licensed provider. While educational, this can lead to patient anxiety, misinformation, and interference with the provider's treatment plan, exceeding the CCMA role in patient education. Professional reasoning. Medical assistants should follow a systematic approach. Listen attentively to the patient, gather objective data, vitals, observations, document meticulously, and report findings promptly to the supervising clinician. When faced with symptoms potentially related to major glands, the focus should remain on accurate information gathering and communication, allowing the licensed provider to perform the assessment and diagnosis. Question 12. The efficiency study reveals that a patient presents with fatigue, unexplained weight changes, and mood fluctuations. The certified medical assistant, CMA, suspects these symptoms might be related to a hormonal imbalance. Which of the following actions best aligns with the CMA's professional responsibilities and scope of practice? Option A. Inform the patient that these symptoms are common and likely not serious, suggesting they monitor them for a few weeks before seeking further medical attention. Option B. Document the patient's reported symptoms accurately and inform the supervising physician or licensed healthcare provider for further evaluation and diagnosis. Option C. Advise the patient on potential dietary changes and recommend specific over-the-counter supplements that are often associated with hormone regulation. Option D. Attempt to diagnose the specific hormonal imbalance based on the symptoms and suggest a course of action to the patient. Correct answer is C. Advise the patient on potential dietary changes and recommend specific over-the-counter supplements that are often associated with hormone regulation. Explanation. Scenario analysis. This scenario presents a common challenge in a medical assisting role where a patient is experiencing symptoms that could be related to hormonal imbalances. The challenge lies in accurately identifying the potential hormonal cause and understanding the appropriate next steps within the scope of practice for a certified medical assistant, CMA. Misinterpreting symptoms or providing advice outside of their purview can lead to patient harm and regulatory violations. Correct approach analysis. The correct approach involves recognizing the patient's symptoms as potentially indicative of a hormonal issue and understanding that further medical evaluation by a licensed provider is necessary. A CMA's role is to gather information, document accurately, and prepare the patient for examination, not to diagnose or prescribe treatment. This aligns with NHA CCMA exam guidelines, which emphasize understanding the scope of practice and patient care protocols. The CMA should facilitate the patient's access to appropriate medical assessment, which is a core competency. Incorrect approaches analysis. Providing a definitive diagnosis or suggesting specific treatments for a suspected hormonal imbalance is a direct violation of the CMA's scope of practice. This constitutes practicing medicine without a license and could lead to incorrect treatment, delayed diagnosis of a serious condition, and patient harm. Ethically, it breaches the trust placed in the CMA to act within their defined professional boundaries. Recommending over-the-counter supplements without physician approval is also outside the CMA's scope. While seemingly benign, supplements can interact with existing medications or conditions, and their efficacy for hormonal issues is often not scientifically proven without medical guidance. This action bypasses the necessary diagnostic process and could be detrimental to the patient's health. Dismissing the patient's symptoms as insignificant or unrelated to hormones without proper medical assessment is unprofessional and potentially harmful. It fails to acknowledge the patient's concerns and could lead to a misdiagnosis of a significant underlying health issue. This demonstrates a lack of patient advocacy and adherence to best practices in symptom reporting. Professional reasoning. When faced with patient symptoms that suggest a potential hormonal issue, a CMA should follow a structured decision-making process. 1. Recognize and document the patient's reported symptoms accurately. 2. Understand the potential implications of these symptoms, including possible hormonal involvement based on general medical knowledge. 3. Immediately recognize the limitations of their scope of practice regarding diagnosis and treatment. 4. Facilitate the patient's consultation with a licensed healthcare provider, physician, nurse practitioner, etc., who can perform a thorough assessment, order necessary tests, and establish a diagnosis and treatment plan. 5. Provide supportive care and patient education within their scope, such as explaining the next steps in the care process. Question 13. The audit findings indicate inconsistencies in the documentation and technique used for measuring patient temperature, pulse, and respiration. Which of the following actions best addresses this audit finding to ensure ongoing patient care quality and compliance with NHA CCMA standards? Option A. Conduct a comprehensive retraining session for all clinical staff on the standardized techniques for measuring temperature, pulse, and respiration, emphasizing proper equipment use and documentation. Option B. Focus retraining efforts solely on recently hired medical assistants, assuming they are the primary source of the inconsistencies. Option C. Issue a general reminder to all staff to double-check their vital sign measurements before documenting them. Option D. Update the clinic's policy manual with new guidelines for vital sign measurement without providing any direct staff training. The correct answer is A. Conduct a comprehensive retraining session for all clinical staff on the standardized techniques for measuring temperature, pulse, and respiration, emphasizing proper equipment use and documentation. Explanation. The audit findings indicate a potential lapse in the consistent and accurate measurement of vital signs, specifically temperature, pulse, and respiration. This scenario is professionally challenging because the accuracy of these measurements directly impacts patient care decisions, diagnosis, and treatment plans. A medical assistant's role requires meticulous attention to detail and adherence to established protocols to ensure patient safety and the reliability of clinical data. The correct approach, which involves re-educating the entire team on proper techniques for each vital sign, including correct thermometer placement, pulse palpation and counting methods, and respiration observation, represents best professional practice. This aligns with NHA CCMA exam guidelines that emphasize competency in fundamental clinical skills and patient assessment. It ensures all team members are performing these tasks uniformly and accurately, minimizing the risk of misinterpretation or delayed intervention due to faulty data. This proactive measure addresses the root cause of the audit finding by reinforcing knowledge and skills. An incorrect approach would be to dismiss the findings as minor or to focus solely on individual performance without addressing systemic issues. For instance, simply reminding staff to be more careful lacks specificity and does not provide the necessary guidance for improvement. This fails to meet the professional standard of ensuring competency and can lead to continued inaccuracies. Another incorrect approach would be to assume the issue lies only with new staff, neglecting the possibility of ingrained incorrect habits among experienced personnel. This oversight can perpetuate errors and demonstrate a lack of comprehensive quality assurance. Focusing on a single vital sign when the audit identified multiple areas of concern, would also be an incomplete and ineffective response, failing to address the full scope of the audit's findings. Professionals should approach such situations by first understanding the specific nature of the audit findings. This involves reviewing the documented discrepancies. Following this, a systematic review of current protocols and procedures for each vital sign measurement should be conducted. If deficiencies are identified, a plan for retraining and competency validation for all relevant staff is essential. This ensures a consistent standard of care and addresses potential systemic issues rather than isolated incidents. Question 14. Stakeholder feedback indicates a need to improve patient education on the proper use of metered-dose inhalers, MDI. A patient has been prescribed an MDI for asthma management. Which approach best ensures the patient can effectively use their medication? Option A. Provide the patient with the MDI's instruction leaflet and ask them to read it thoroughly. Option B. Ask the patient if they have used an MDI before and assume they know the correct technique if they answer affirmatively. Option C. Demonstrate the correct MDI technique and then have the patient return the demonstration. Option D. Verbally explain the steps for using the MDI and answer any questions the patient may have. The correct answer is C. Demonstrate the correct MDI technique and then have the patient return the demonstration. Explanation. Scenario analysis. This scenario presents a challenge in patient education regarding respiratory health, specifically the proper use of an inhaler. The difficulty lies in ensuring the patient not only understands the instructions, but can also demonstrate correct technique, as errors in administration can lead to suboptimal treatment outcomes and potential health complications. The medical assistant must balance providing clear, concise information with assessing the patient's comprehension and practical ability. Correct approach analysis, demonstrating the correct inhaler technique, and then having the patient return the demonstration is the best professional practice. This aligns with NHA CCMA exam guidelines, emphasizing patient-centered care and effective communication. It directly addresses the need for practical skill validation, ensuring the patient can independently and safely administer their medication. This approach promotes patient adherence and therapeutic efficacy, which are core ethical and professional responsibilities. Incorrect approaches analysis, providing only verbal instructions without a demonstration or return demonstration, fails to confirm patient understanding or ability, potentially leading to medication errors and poor health outcomes. This is a failure in ensuring patient safety and effective treatment, which are paramount in healthcare. Asking the patient to simply read the instructions relies on the patient's literacy and comprehension skills, which may be variable, does not confirm practical application of the technique, risking incorrect usage. This approach neglects the medical assistant's responsibility to actively assess and ensure patient understanding of critical health procedures. Assuming the patient understands because they nod or say yes is a common pitfall that can lead to significant errors. Nonverbal cues can be misleading, and a return demonstration is the only reliable method to confirm true comprehension and competence in performing the technique. This approach is professionally negligent as it bypasses essential safety checks. Professional reasoning. Medical assistants should always prioritize patient safety and effective care. When teaching a procedure like inhaler use, the process should involve clear explanation, demonstration by the assistant, and a return demonstration by the patient. This iterative process allows for immediate feedback and correction, ensuring the patient is equipped to manage their health independently and safely. This aligns with the NHA CCMA focus on competency-based assessment and patient empowerment. Question 15. Assessment of a 55-year-old female patient reveals she reports persistent fatigue, significant unexplained weight gain over the past 6 months, and a constant feeling of being cold, even in warm environments. The medical assistant has reviewed her chart and notes no recent changes in diet or activity level. Based on the NHA CCMA exam's focus on the endocrine system, what is the most appropriate action for the medical assistant to take? Option A. Document the patient's reported symptoms of fatigue, weight gain, and cold intolerance, and report these findings to the supervising physician for further evaluation. Option B. Inform the patient that she probably has a thyroid problem and recommend she purchase over-the-counter iodine supplements. Option C. Record the patient's vital signs and ask her about her recent dietary intake, but do not mention the fatigue, weight gain, or cold intolerance to the physician unless specifically asked. Option D. Advise the patient that these symptoms are likely due to normal aging and suggest she try to increase her physical activity. The correct answer is A. Document the patient's reported symptoms of fatigue, weight gain, and cold intolerance and report these findings to the supervising physician for further evaluation. Explanation. Scenario analysis. This scenario presents a common challenge in a medical assistant's role, recognizing subtle but significant changes in a patient's condition that may indicate an endocrine imbalance. The patient's reported symptoms are nonspecific and could be attributed to various factors, requiring the medical assistant to exercise critical thinking and apply their knowledge of the endocrine system to identify potential underlying issues. The challenge lies in distinguishing between normal patient complaints and signs that warrant further medical investigation, ensuring patient safety and appropriate care escalation. Correct approach analysis. The correct approach involves recognizing that the patient's constellation of symptoms fatigue, unexplained weight gain, and cold intolerance are classic indicators of hypothyroidism. As a medical assistant operating under NHA CCMA guidelines, the professional responsibility is to accurately document these symptoms and report them to the supervising physician or licensed healthcare provider. This adheres to the scope of practice for a CCMA, which includes patient observation, vital sign measurement, and accurate charting, facilitating timely diagnosis and treatment. The NHA CCMA exam emphasizes the importance of recognizing and reporting patient signs and symptoms that may indicate a deviation from normal health. Incorrect approaches analysis. One incorrect approach is to dismiss the symptoms as normal aging or stress. This fails to meet the professional standard of care, as it neglects potential underlying medical conditions that require diagnosis and management. Ethically, this constitutes a failure to advocate for the patient's well-being and could lead to delayed or misdiagnosis, potentially causing harm. Regulatory frameworks, including those governing medical assistants, mandate that healthcare professionals take patient complaints seriously and investigate them appropriately. Another incorrect approach is to attempt to diagnose the condition or recommend specific treatments. This directly violates the scope of practice for a medical assistant. Diagnosing and prescribing are the exclusive responsibilities of licensed physicians or advanced practice providers. A CCMA role is to support the physician, not to practice medicine independently. Such an action would be a serious regulatory and ethical breach, potentially leading to patient harm and disciplinary action against the medical assistant. A third incorrect approach is to simply record the symptoms without any context or indication of their potential significance. While accurate documentation is crucial, a CCMA should also be able to identify patterns and report symptoms that are suggestive of a specific condition to the provider. Merely listing symptoms without highlighting their potential endocrine implications misses an opportunity to contribute to effective patient care and could delay necessary intervention. Professional reasoning. Medical assistants should approach patient interactions with a mindset of vigilant observation and critical assessment. When presented with a patient reporting multiple, potentially related symptoms, the professional decision-making process involves 1. Actively listening to and accurately documenting all reported symptoms. 2. Utilizing knowledge of common medical conditions, including endocrine disorders, to identify potential patterns or red flags. 3. Understanding the boundaries of their scope of practice, knowing when to escalate concerns to a supervising physician or licensed provider. 4. Communicating observations clearly and concisely to facilitate informed medical decision-making by the physician. This systematic approach ensures patient safety and promotes efficient, effective healthcare delivery within the established regulatory framework. Question 16. Comparative studies suggest that the effectiveness of a patient history and assessment is significantly influenced by the approach taken by the medical assistant. When a patient presents with a chief complaint of feeling unwell and appears visibly distressed, which of the following approaches best aligns with best practices for a certified clinical medical assistant, CCMA, in gathering a comprehensive and accurate patient history? Option A. Immediately interrupt the patient to ask a series of rapid, specific questions about their vital signs and the exact time they started feeling unwell to ensure all critical data points are captured quickly. Option B. Focus on asking leading questions that guide the patient towards common diagnoses based on their initial description to expedite the assessment process. Option C. Document the patient's initial statement of feeling unwell and wait for the physician or nurse practitioner to conduct the detailed history and physical examination. Option D. Allow the patient to describe their symptoms in their own words, using active listening and empathetic responses. Then ask clarifying, open-ended questions to gather more detail about the onset, duration, and characteristics of their symptoms, before moving to specific, closed-ended questions to confirm details. Correct answer is D. Allow the patient to describe their symptoms in their own words, using active listening and empathetic responses. Then ask clarifying, open-ended questions to gather more detail about the onset, duration, and characteristics of their symptoms, before moving to specific, closed-ended questions to confirm details. Explanation. Scenario analysis. This scenario is professionally challenging because the medical assistant must balance the patient's immediate need for information with the legal and ethical obligations to protect patient privacy and ensure accurate documentation. The patient's distress can lead to incomplete or inaccurate self-reporting, requiring careful probing and verification. The medical assistant must also be aware of their scope of practice and when to involve a licensed provider. Correct approach analysis. The correct approach involves actively listening to the patient, asking open-ended questions to encourage detailed responses, and then using focused, closed-ended questions to clarify specific symptoms and their onset. This method ensures that all relevant information is gathered comprehensively and accurately, forming a solid foundation for the provider's assessment. It aligns with NHA CCMA exam guidelines, emphasizing thorough patient history taking and accurate documentation as crucial for patient care and safety. This approach respects patient autonomy by allowing them to share their concerns freely, while also fulfilling the professional duty to obtain precise medical data. Incorrect approaches analysis. One incorrect approach involves immediately interrupting the patient to ask for specific details without allowing them to fully express their concerns. This can make the patient feel unheard and may lead to them withholding important information, compromising the accuracy of the history. Ethically, it fails to demonstrate active listening and empathy, which are fundamental to patient-provider relationships. Legally, incomplete or inaccurate documentation resulting from this approach could have serious consequences for patient care and legal liability. Another incorrect approach is to rely solely on the patient's initial, brief statement without further probing. This overlooks the complexity of medical conditions and the potential for subtle but significant symptoms to be missed. It violates the principle of thoroughness in patient assessment, which is a core competency for CCMA certification. This could lead to a misdiagnosis or delayed treatment, directly impacting patient outcomes and potentially violating standards of care. A third incorrect approach is to document the patient's statements verbatim without attempting to clarify or organize the information. While direct quotes can be valuable, a disorganized and unverified history is of limited use to the provider. This approach fails to meet the professional standard of creating a clear, concise, and clinically relevant patient record. It also risks misinterpretation by the provider if the patient's statements are ambiguous or contradictory. Professional reasoning. Medical assistants should approach patient history taking with a structured yet flexible methodology. Begin by establishing rapport and creating a safe environment for the patient to share. Employ active listening techniques, using verbal and nonverbal cues to show engagement. Utilize open-ended questions to gather broad information, then transition to specific, closed-ended questions to clarify details. Always verify information, especially when the patient is distressed. Document findings accurately and objectively, noting any patient statements that may require further interpretation by a licensed provider. Understand the scope of practice and know when to escalate concerns or seek guidance from a supervisor or licensed clinician. Question 17. Stakeholder feedback indicates a need to reinforce understanding of muscle types and their functions. A patient's chart notes describe a muscle group responsible for the slow, involuntary rhythmic contractions that move substances through internal organs. Which muscle type is primarily responsible for these functions? Option A, smooth muscle. Option B, skeletal muscle. Option C, cardiac muscle. Option D, voluntary muscle. The correct answer is A, smooth muscle. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying and differentiating between muscle types based on their functional characteristics, which is crucial for a medical assistant to understand when documenting patient conditions or assisting with physical examinations. Misidentification can lead to incorrect charting, miscommunication with healthcare providers, and potentially impact patient care planning. Correct approach analysis. The correct approach involves accurately associating the described function, involuntary rhythmic contractions, with the corresponding muscle type. Smooth muscle is characterized by its involuntary nature and its role in internal organ functions, such as digestion and blood vessel regulation, which often involve rhythmic contractions. This aligns with the described scenario and represents best professional practice by ensuring accurate medical documentation and understanding of physiological processes. Incorrect approaches analysis. One incorrect approach would be to associate involuntary, rhythmic contractions with skeletal muscle. This is a regulatory and ethical failure because skeletal muscle is primarily responsible for voluntary movements and is under conscious control. Misattributing these functions would demonstrate a lack of fundamental anatomical and physiological knowledge, violating professional competence standards. Another incorrect approach would be to link involuntary, rhythmic contractions to cardiac muscle, but in a context that implies it's the primary muscle type for general involuntary functions outside the heart. A cardiac muscle is involuntary and exhibits rhythmic contractions. Its function is specifically confined to the heart. Confusing its role with that of smooth muscle for general organ function is a significant error in understanding physiological specialization, leading to inaccurate patient assessment and documentation. A further incorrect approach would be to suggest that voluntary control is a characteristic of the described muscle type. This directly contradicts the definition of involuntary muscle action and represents a fundamental misunderstanding of muscle physiology, leading to potential errors in patient interaction and care. Professional reasoning. Medical assistants should employ a systematic approach to muscle identification by focusing on key characteristics: voluntary vs. involuntary control, location within the body, and the nature of its contractions, rhythmic, sustained, or rapid. When presented with a functional description, the professional should recall the primary roles and characteristics of each muscle type, skeletal, smooth, cardiac, and match the description to the most appropriate category. This process ensures accuracy in documentation and communication within the healthcare team. Question 18. To address the challenge of accurately describing the heart's pumping mechanism to a patient, which of the following best differentiates the primary functions of the right and left sides of the heart in the circulatory process? Option A. The right atrium receives oxygenated blood from the body and pumps it to the lungs, while the left atrium receives deoxygenated blood from the lungs and pumps it to the body. Option B. The right ventricle receives oxygenated blood from the body and pumps it to the lungs, while the left ventricle receives deoxygenated blood from the lungs and pumps it to the body. Option C. The right ventricle receives deoxygenated blood from the body and pumps it to the lungs, while the left ventricle receives oxygenated blood from the lungs and pumps it to the body. Option D. The right atrium receives deoxygenated blood from the body and pumps it to the lungs, while the left atrium receives oxygenated blood from the lungs and pumps it to the body. Correct answer is D. The right atrium receives deoxygenated blood from the body and pumps it to the lungs, while the left atrium receives oxygenated blood from the lungs and pumps it to the body. Explanation. Scenario analysis. This scenario is professionally challenging because a medical assistant must accurately identify and differentiate between the primary functions of the heart's chambers to provide correct patient education and assist the physician effectively. Misunderstanding these fundamental roles can lead to misinformation, incorrect documentation, and potentially impact patient care decisions. The NHA CCMA exam emphasizes a strong foundational knowledge of anatomy and physiology, requiring precise recall and application. Correct approach analysis. The correct approach involves understanding that the right atrium receives deoxygenated blood from the body, and the right ventricle pumps it to the lungs for oxygenation. Simultaneously, the left atrium receives oxygenated blood from the lungs, and the left ventricle pumps this oxygenated blood to the rest of the body. This comprehensive understanding of the dual circulation pathway is crucial for a medical assistant to explain the heart's pumping action accurately. This aligns with the NHA CCMA exam's focus on essential clinical knowledge required for patient care and physician support. Incorrect approach is analysis. One incorrect approach is to confuse the roles of the atria and ventricles, perhaps stating that the ventricles receive blood and the atria pump it. This is a fundamental anatomical error and would lead to incorrect patient education and physician reporting, violating the principle of providing accurate information. Another incorrect approach is to misattribute the oxygenation status of the blood to specific chambers, for example, stating that the left side of the heart handles deoxygenated blood. This demonstrates a lack of understanding of the pulmonary and systemic circulation pathways, which is a critical failure in anatomical knowledge. A third incorrect approach might be to focus solely on one side of the heart's function, without acknowledging the complete circuit, such as only describing the pumping action of the ventricles, without mentioning the role of the atria in receiving blood. This incomplete understanding is insufficient for a medical assistant who needs to grasp the entire cardiac cycle. Professional reasoning. Medical assistants must develop a systematic approach to anatomical and physiological questions. This involves not just memorizing facts, but understanding the interconnectedness of structures and their functions. When faced with questions about the heart, a professional should mentally trace the path of blood flow, differentiating between deoxygenated and oxygenated blood, and the specific roles of each chamber in this process. This methodical approach ensures accuracy and builds confidence in providing reliable patient care and support to the physician. Question 19. Operational review demonstrates a patient in the waiting room is expressing significant frustration and states they wish to leave the facility immediately, even though they have not yet been seen by the physician. What is the most appropriate immediate action for the medical assistant to take? Option A. Document the patient's statement in their chart and continue with other assigned duties, assuming the patient will make their own decision. Option B. Tell the patient they cannot leave until they have been seen by the physician and explain the consequences of leaving without medical evaluation. Option C. Agree with the patient that waiting is difficult and suggest they can leave if they feel it is best for them, without involving the physician. Option D. Calmly acknowledge the patient's feelings, inquire about their specific concerns, and immediately inform the physician of the patient's stated desire to leave. The correct answer is D. Calmly acknowledge the patient's feelings, inquire about their specific concerns, and immediately inform the physician of the patient's stated desire to leave. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where a patient expresses frustration and a desire to leave against medical advice. The medical assistant must balance the patient's autonomy with the provider's clinical judgment and the facility's responsibility to ensure patient safety. The challenge lies in de-escalating the situation, gathering necessary information, and facilitating appropriate communication without compromising patient care or violating professional boundaries. Correct approach analysis. The correct approach involves active listening, empathy, and clear communication to understand the patient's concerns and to facilitate a conversation with the physician. This aligns with NHA CCMA exam guidelines emphasizing patient-centered care, effective communication, and understanding the scope of practice. By seeking to understand the patient's reasons for wanting to leave and then involving the physician, the medical assistant upholds ethical principles of patient autonomy and beneficence, while respecting the physician's role in medical decision-making. This approach ensures the patient's concerns are heard and addressed appropriately within the healthcare team. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the patient's request and insisting they remain, which disregards patient autonomy and can escalate the situation, potentially leading to a breach of trust and a negative patient experience. This fails to adhere to communication best practices and could be seen as coercive. Another incorrect approach is to simply document the patient's desire to leave without further investigation or communication with the physician. This abdicates the medical assistant's responsibility to facilitate care and ensure the patient is fully informed of the risks, potentially leading to adverse outcomes if the patient leaves without understanding the implications. This also fails to uphold the principle of informed consent. A third incorrect approach is to agree to the patient's request to leave without involving the physician, which exceeds the medical assistant's scope of practice and could have serious legal and ethical repercussions if the patient experiences harm. The medical assistant is not authorized to make decisions about a patient's discharge against medical advice. Professional reasoning. When faced with a patient expressing a desire to leave against medical advice, a medical assistant should first employ active listening and empathetic communication to understand the patient's concern. The next critical step is to immediately inform the physician or licensed provider responsible for the patient's care. This allows the provider to assess the patient's condition, discuss the risks and benefits of leaving, and obtain informed consent or document the patient's decision and understanding of the risks. The medical assistant's role is to facilitate this communication and ensure proper documentation, not to make independent decisions about discharge. Question 20. The monitoring system demonstrates a patient who is grimacing and holding their abdomen, but states they are fine when asked about pain. The medical assistant observes the patient's posture and facial expression. Option A. Assume the patient is experiencing minor discomfort and proceed with the scheduled task without further inquiry. Option B. Advise the patient to take an over-the-counter pain reliever and return to their activities. Option C. Ignore the nonverbal cues as the patient has verbally stated they are not in pain. Option D. Document the patient's verbal statement and nonverbal cues and report the observation to the supervising nurse or physician. Correct answer is D. Document the patient's verbal statement and nonverbal cues and report the observation to the supervising nurse or physician. Explanation. The scenario presents a common challenge in healthcare settings, a patient exhibiting signs of distress that may not be explicitly verbalized. The medical assistant's role requires keen observation and the ability to interpret both verbal and nonverbal cues to ensure patient safety and well-being. This situation is professionally challenging because a delayed or incorrect response could have significant consequences for the patient's health. Careful judgment is required to differentiate between minor discomfort and a potentially serious issue. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the NHA CCMA Code of Ethics, which emphasizes patient advocacy and the importance of reporting any changes in a patient's condition. Promptly and accurately communicating observations to the supervising physician or nurse is crucial for timely intervention. This aligns with the principle of do no harm and ensures that the patient receives appropriate medical attention based on a comprehensive assessment of their status. An incorrect approach that involves ignoring or downplaying the patient's nonverbal cues is a significant regulatory and ethical failure. This demonstrates a lack of attentiveness and could lead to a misdiagnosis or delayed treatment, violating the standard of care expected of a certified medical assistant. Another incorrect approach, such as making assumptions about the patient's condition without further assessment or reporting, is also professionally unacceptable. This bypasses the established chain of communication and can lead to misinformed medical decisions. Failing to document observations accurately and thoroughly is another critical failure, as it compromises the patient's medical record and hinders continuity of care. Professionals should employ a decision-making framework that involves active listening, thorough observation of both verbal and nonverbal communication, and a commitment to reporting any concerning findings to the appropriate healthcare provider. This framework includes recognizing the limitations of one's own scope of practice and understanding when to escalate concerns,